This is LiveWell Talk on new Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is another installment in a series on the podcast where we sit down with new clinicians at UnityPoint Health, Cedar Rapids, and get to know them, not only as a clinician, but also as a person. Our guest on today's episode is Dr. Taylor King, a pediatrician at UnityPoint Clinic Pediatrics, Terrace. Dr. King, welcome.
Thank you for having me.
Where are you from?
So I'm from Dubuque, Iowa, originally. I've been all over a little bit with training and my partner's training. So most recently we were in Minneapolis. Before that, Arizona.
Oh, wow.
I did training in Milwaukee. So I've kind of been everywhere, and it's nice to be a little closer to home recently.
Where did you go to undergrad at?
Yeah, undergrad at the University of Iowa.
Okay.
So in Iowa City.
And then medical school where?
Des Moines. So Des Moines
Okay.
University. Yeah.
And then you did a residency in pediatrics?
Correct. Yep. I did my residency at the Medical College of Wisconsin at the Children's Hospital there in Milwaukee.
Oh, cool.
Yes.
That's a big hospital.
Yes.
Yeah.
Yeah, it is.
Because there's also like a St. Luke's in Milwaukee too that's really big.
Yeah, they have a few large hospital systems there. Yeah.
You mentioned you have a partner. And
I do.
They trained as well?
Correct. Jordan King. Yep. He is actually an anesthesiologist.
Oh, yeah. Yeah, we know him.
Yep. With LCA. Yes.
Okay.
Yeah. So he's from Cedar Rapids. So that's kind of
right.
what prompted our move back to the area, be a little closer to his family and my family.
Yeah.
Yeah.
Well, a 2-doctor family.
Yeah. We're excited to be here.
Well, why did you choose pediatrics?
Yeah. So I chose pediatrics because I really felt called to be an advocate for children. I really liked that aspect of that specialty. Kids don't always have the loudest voice in the room. And so for me, being one of their advocates along with their families and parents was really special to me. I also thought it was really challenging compared to a lot of other specialties. So you have to be really good at your physical exam because they can't really tell you what hurts or what's going on. So yeah, those are kind of two of the reasons I really was called to the field.
And if you could describe your practice and to potentially, the parents that are listening, how would you describe kind of your philosophy on taking care of patients?
So I really strive to create a very approachable environment for my patients and families. I want them to feel comfortable and supported so that they know that they can ask questions, voice concerns without judgment. I really strive to create those partnerships with patients and families so that they feel empowered to take a pretty active role in their health.
Is there any area of pediatrics that kind of your favorite?
Yeah, my favorite, I really love neonatal medicine. So I love taking care of newborns. I love being in the nursery on the L&D unit kind of right after delivery and supporting parents and kids as they kind of transition into the world is one of my favorites.
Well, so obviously, who decided to come? So Jordan's from Cedar Rapids. You're from Dubuque. Mm-hmm. So river town. So, we won't hold that against you. My mom's from Dubuque.
Oh,
so,
is she?
yeah.
Okay.
But what drew you to UnityPoint Health? I mean, we know why you came to Cedar Rapids, but there's another hospital in Cedar Rapids. We won't mention its name. But why UnityPoint Health? Yeah,
so when I interviewed with UnityPoint, it was really like all the people I met that kind of drew me to the organization. Everyone from, the physicians, the nurse practitioners, PAs, clinical staff, they all seemed really happy and I think seemed to have kind of one goal in common, and that was taking the best care of their patients. And so to me, it was kind of a no-brainer after I interviewed.
I mean, I'm a little biased, of course, but I think we have a great culture. Yeah. And I think, I generally like the people I work with. I look forward to being around them. And I think that's throughout the entire organization. People feel that way. Yeah, I agree. And not everyone can say that, so I feel pretty lucky. No, you're absolutely right. I mean, culture is a word that you throw around, but it's your behavior and your beliefs. And I think we believe in what we do and we treat each other with respect and we behave appropriately. And so this is a good place to work.
Definitely. I agree.
What do you do for fun?
So I love to golf. Jordan and I golf pretty frequently when we can, when it's nice out. I like to read a lot. We have a little dog, so we take him on walks and hikes. What kind of dog? He's a golden doodle.
Oh, my gosh.
His name's Cooper.
Oh, gosh. I'm a huge dog
person.
Yeah.
Yeah. Do you have dogs?
Yeah, we have a Bernedoodle and a Pouchon.
Oh, nice. Wonderful.
Oliver and Sapphire.
Yeah, sweet.
One's about 100 pounds, the other's 10 pounds.
Oh my gosh, 100 pounds.
Yeah.
That's crazy.
Yeah, Oliver's big. Well, Dr. King, thank you for coming. Once again, this is Dr. Taylor King, a pediatrician with UnityPoint Clinic Pediatrics, Tower Terrace. If you are interested in scheduling an appointment with Dr. King, call UnityPoint Clinic Pediatrics, Tower Terrace at 319-206-7370, 319-206-7370. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.